This is Your Brain on Food, The Effects of Fuel on Your Most Important Organ, by Briana, ABE170A at the University of Arizona. The brain. The brain controls every aspect of your body's functions and takes the biggest amount of energy to run relative to the other organs. This presentation will examine how the brain gets fuel and how a lack of nutrients hinders production. Food, nutrients, and minerals directly affect brain function from a physical, psychological, and emotional standpoint. Measurement of brain activity. MRI stands for magnetic resonance imaging, and this is the best way to look at the brain. It uses a strong magnetic field to align atoms in the body, and as these protons move, they emit energy. The scanner picks these up and shows the radio waves as a picture. An MRI cannot examine function. However, a functional MRI, or fMRI, can. The fMRI measures the brain activity using the detection of increased blood flow. Blood shows up differently on the scan depending on whether or not it contains oxygen. These measurements of the brain are used medically and also in research. Positive dietary factors. In a study performed looking at the effects of nutrients on brain function, it was found that there are many dietary factors that affect the stabilization of mental processes. One important positive nutrient is omega-3 fatty acids. These support cognitive developments. These can be found in fish, kiwi, seeds, and some nuts. Docosahexacic acid, or DHA, a type of omega-3, was found to have a large impact on evolution. When DHA was abundant, it increased the brain-to-body mass ratio. In this photo, you can see that as the DH levels improved, the brain grew greatly in size. On the contrary, a deficiency in omega-3 can lead to disorders, in particular Alzheimer's disease. This is a disorder of the brain where neurons clump together, causing memory deficits. Other dietary factors. Saturated fats, majorly found in junk food, have been proven to increase the risk of neurological problems. The study showed that these fats produced a decline in cognitive performance after only 3 weeks. As a result, the conclusion that diet has a direct effect on neurons was found. There are many hormones that interact with the brain. Some of these hormones include leptin and ghrelin. Leptin is responsible for reducing appetite. It is known that a deficiency can cause learning disabilities and depression. Ghrelin is the opposite because it spurs on appetite, and a deficiency can lead to starvation. Vegetarianism. This is a diet defined by not eating meat, and that leads to the lack of protein. DHA is a key nutrient for brain function, and that is absent in vegetarian and vegan diets. Since DHA is needed to increase brain size in both vegetarians and vegans, they must get this nutrient elsewhere to facilitate growth. These deficits have shown to cause higher rates of depression and anxiety. Those who became vegetarians earlier in life are more at risk than later converts. Also, the ones who eat fish and some meat are in a less dangerous situation. Can vegetarianism help with fibromyalgia? The vegetarian diet was used in an attempt to reduce pain in patients with fibromyalgia. Researchers had subjects adopt the diet. They then predicted that the decrease of tryptophan in their diets could help alleviate the brain. Unfortunately, this strategy did not reduce symptoms or pain of fibromyalgia in these subjects. This study proved that food is a key factor in brain health. Malnutrition and dementia. In a recent study on Alzheimer's disease, nutritional evidence was found correlating malnutrition and the development of Alzheimer's disease. Alzheimer's disease is the main cause of dementia. The researchers stated that more evidence has been uncovered to support the finding that nutrition is essential for Alzheimer's disease. This is seen in their weight hypothesis. They state that overweight adults have a much better chance at developing dementia. In contrast, adults with high body mass index who lose weight slower as they age reduce their risk for disease. When the weight loss is rapid, the onset of Alzheimer's disease is also increased. Eating disorders. It has been shown that eating disorders can lead to neurocognitive deficits. Some of these common problems include problems transitioning between tasks and grasping the big picture. These effects are so strong they can be seen even after the person ceases the eating disorder. Many eating disorders are spurred on by low self-esteem, driven by the media's ideas of body image. In extreme cases, people will starve themselves and end up damaging their brain all at the same time. The brain needs nutrients to function at full capacity, and if it is not fed, complications arise. Conclusion. From a physical, psychological, and emotional outlook, the brain is affected by its intake of food, nutrients, and minerals. The best way to biologically measure brain activity is with a functional MRI. An abundance of omega-3 helps facilitate brain growth. Vegetarians lack this nutrient, and proteins are also absent from their diet. Malnutrition is a problem as well because it speeds up the onset of Alzheimer's disease. This is also an issue with people who have eating disorders. When the brain does not get proper nutrition, it cannot function to its full capacity. The brain is crucial to regulating every aspect of the body, and it must be fully fed to do so. Keep your brain's health in mind next time you bite into anything. It could be the difference between life and death. Questions? The end.